Every time you walk into a doctor's office, a silent clock starts ticking. But it's not just counting down your 15-minute appointment. Deep inside your digital medical file, tucked away in the metadata of the American healthcare system, there is a number you were never meant to see. It's an invisible expiration date. A calculation that determines if you're worth the top-tier treatment or just the comfortable alternative. I've sat in those boardrooms. I've reviewed the insurance algorithms, and I've heard the quiet conversations in the surgical lounges. While you're sitting on that crinkly exam paper table, hoping for a breakthrough, the system is often asking a much colder question: how much return on investment is left in this life? Tonight, I'm pulling back the curtain on the trillion-dollar machinery of American healthcare to reveal the 5 ugly truths about how seniors are actually viewed by the system. We aren't just talking about rude doctors or long wait times. We're talking about implicit bias, a psychological blind spot that causes even the best physicians to overlook life-saving symptoms simply because of the year you were born. By the time we get to truth number 1, you'll realize that the most dangerous thing in an emergency room isn't your blood pressure or a virus. It's the date on your birth certificate. If you've ever felt brushed off, rushed out, or told that your pain is just a part of getting older, you weren't imagining it. You were being processed. Let's stop being patients and start being advocates. This is the truth about the silent expiration date, and more importantly, how you can erase it. Let's talk about a man named Arthur. Arthur is 67, a retired civil engineer who spent his life building bridges that lasted decades. He's sharp, active, and loves hiking. But like many of us over 60, Arthur's body has a few maintenance issues. He's managing type 2 diabetes, high blood pressure, and a bit of nagging back pain. To you, Arthur is a whole person. To the modern healthcare system, Arthur is a high-complexity case. And in a system built for speed, complexity is a crime that carries a heavy tax. In the US, most primary care visits are reimbursed at a flat rate. Whether you have a simple cough or a jigsaw puzzle of 5 different chronic conditions, the doctor's office often gets paid roughly the same for that time slot. This creates a phenomenon I call the clinical complexity tax. When you walk in with multiple issues, the system doesn't see a puzzle to solve. It sees a file too heavy to open. A landmark study in the Journal of General Internal Medicine surveyed hundreds of physicians, and the results were heartbreaking. Nearly 60% of doctors admitted to feeling overwhelmed or even frustrated when treating seniors with multiple conditions. Why? Because complexity takes time, and in a corporate-owned clinic, time is the one thing they aren't allowed to give you. Look at what happens to Arthur. He wants to talk about his new, sharp back pain. But the doctor sees his history of gout and arthritis and shortcuts the diagnosis. He assumes it's just the old wear and tear. He writes a quick prescription for a muscle relaxant and moves to the next room. This is therapeutic nihilism, a fancy way of saying the doctor has subconsciously decided that because you're older and have too much going on, significant improvement isn't really possible anyway. But here's the kicker: Arthur's back pain wasn't arthritis. It was a localized infection that, if caught early, needed simple antibiotics. Because he was too complex to investigate thoroughly, he was sent home with a pill that masked the symptoms while the infection grew. Physiologically, your body at 70 is like a classic car.
The systems overlap. A problem in your kidneys can look like a problem in your heart.
A side effect from a blood pressure pill can look like early-onset dementia. Sorting this out requires a detective, not a clerk. But when doctors feel the complexity tax biting into their schedule, they stop being detectives. They start stacking prescriptions, adding a pill for the side effect of another pill, until your medicine cabinet looks like a chemical experiment. According to a 2020 report in Age and Aging, seniors with 3 or more chronic conditions are twice as likely to be misdiagnosed compared to middle-aged adults. You are literally paying for your life's experience with a higher risk of medical error. So, how do you stop being a heavy file and start being a priority? You have to flip the script. First, use the rule of 3. Never walk in with a list of 10 things. Pick your top 3 most urgent concerns and state them in the first 60 seconds. Second, ask for a comprehensive medication review twice a year. Force the system to look at the interaction of your drugs, not just the dosage. And third, if a doctor tells you a symptom is just a part of your complex history, ask this magic question: if I were 35 and standing here with this exact pain, what tests would you run? Don't let them tax your health because they're too busy to do the math. You aren't a burden, you're a masterpiece of biological history, and you deserve a doctor who is willing to read the whole book, not just the cliff notes. In the legal world, an alibi is a story used to prove you weren't at the scene of the crime. In the medical world, old age is the ultimate alibi. It's the convenient excuse used to explain away symptoms that would trigger an immediate sirens and lights response in a 30-year-old. When you're 70, The system often stops looking for the why and simply points to the when, as in, when you were born.
Meet Sarah.
Sarah is 72. For the last 6 months, she's been feeling a crushing weight of fatigue. Her walks are shorter, her brain feels foggy, and she's noticed her hair thinning. She goes to her doctor, hoping for a blood test or a scan. The doctor looks at her, gives a sympathetic pat on the shoulder, and says, "Well, Sarah, you've lived a long, full life. A little slowing down is to be expected at 72. Maybe try some vitamin D and more rest."
That right there?
That's the old age alibi. Because Sarah didn't have old age. She had hypothyroidism, a thyroid gland that had practically shut down. It's a condition that is 100% treatable with a simple, inexpensive pill. But because Sarah was 72, her doctor subconsciously filed her suffering under natural decline instead of clinical pathology.
This is what we call diagnostic shadowing.
It's a medical blind spot where a patient's age casts such a large shadow that the actual disease hiding behind it becomes invisible. Think about the danger of that. If a 25-year-old athlete complains of sudden shortness of breath, they're rushed to get an EKG and a pulmonary scan. If you complain of the same thing, the system often assumes your heart is just tired. The science is chilling. Studies on ageism in healthcare show that providers often have lower expectations for the health outcomes of older adults. This leads to what researchers call undertreatment. We see this in everything from depression, which is frequently dismissed as just a part of being old and lonely, to heart disease and even early-stage cancers. Physiologically, your cells don't just decide to fail because of a calendar date.
Pain is a signal. Fatigue is a symptom.
Confusion is a red flag. None of these are normal, regardless of whether you are 17 or 97. When a doctor uses your age as an alibi to avoid doing the diagnostic work, they aren't just being nice or realistic, they are being negligent. According to research published in the Journal of the American Geriatric Society, nearly 40% of older adults feel that their concerns are dismissed by clinicians as being age-related. That's millions of Americans walking around with treatable conditions that are being ignored until they turn into emergencies.
So, how do you break the old age alibi?
You have to change the language of the conversation. Next time a provider tells you a symptom is just because you're getting older, I want you to use this specific script. Look them in the eye and say, "I understand that aging involves changes. However, my left knee feels great, and it's the same age as my right knee which is screaming in pain. If I were 40 years younger, what would be the first diagnostic test you'd order to find the cause?" Force them to separate your biological age from your chronological age.
Demand the under 40 standard of care.
Because your golden years shouldn't be spent enduring treatable pain just because a doctor decided your symptoms were on schedule. There's a label doctors often use in their private notes that can haunt you for the rest of your life. It's just 2 words, non-compliant. It sounds like a legal term, but in the medical world, it's a scarlet letter. And for the American senior, there is a trap being set the moment you walk out of the clinic with a handful of prescriptions. It's a trap built on the assumption that you won't succeed, and because the system expects you to fail, it stops trying to help you win. Here is the staggering reality: more than 50% of older adults do not take their medications as prescribed. That's a fact from the American Journal of Geriatric Pharmacotherapy. But here's what the ugly truth is: most doctors look at that number and blame you. They blame your memory, your stubbornness, or your lack of interest in your own health. But as someone who has seen the inner workings of this system, I'm here to tell you the blame is misplaced. The system designs these plans to be nearly impossible to follow. They give you a pill for the ill, then a second pill for the side effects of the first, and a third to protect your stomach from the second. Before you know it, you're managing a pharmaceutical cocktail that would confuse a chemistry professor. Doctors know this complexity is overwhelming, so many of them simply quiet quit on your treatment. They write the script, but in their minds, they've already checked the won't follow through box.
This is the silent adherence trap.
Because they assume you'll miss doses, they might avoid giving you the most cutting-edge, effective therapies that require precision. Instead, they default to safe but less effective options. They lower their standards for your care because they've lowered their expectations of your capability.
Think about Dorothy. She is not defiant.
She's scared. Her inhaler makes her heart race, so she stops using it. But she stays silent because she doesn't want to be labeled difficult. Her doctor sees her lung function dropping, assumes the medicine isn't strong enough, and increases the dose. Now Dorothy is in a dangerous loop, all because the adherence trap destroyed the honest communication between her and her physician. Physiologically, this is a disaster. Skipping blood thinners for a few days isn't just forgetfulness. It's an open invitation for a stroke. Ignoring diabetes meds because they make you nauseous isn't non-compliance. It's a cry for a better treatment plan.
The science backs up the bias.
A 2019 study in JAMA Internal Medicine found that once a senior is labeled non-cooperative in their digital charts, the aggressiveness of their treatment plan drops by nearly 70%. The system effectively gives up on you. To escape this trap, you must practice radical honesty. If you aren't taking a pill, tell the doctor. But don't just say, "I stopped." Say, "I am not taking this because the side effects are ruining my quality of life. I need you to work with me to find an alternative that I can actually live with." Stop accepting more pills as the only solution. Ask about deprescribing, a growing medical movement focused on reducing unnecessary medications. And finally, bring your brown bag of meds to every appointment.
Dump them on the table.
Make the doctor see the mountain they're asking you to climb. When you show them the reality, you force them to move from judging to solving.
In the world of professional sprinting, 11 seconds is an eternity.
But in a medical exam room, it is the exact amount of time you have to speak before the system shuts you down. This isn't just a rude habit, it's a structural flaw in American medicine that turns your healthcare into a drive-through window. Research published in the Journal of General Internal Medicine reveals a heartbreaking statistic. The average doctor interrupts a patient just 11 to 18 seconds after they start speaking. Now, imagine you're 70 years old. You have a complex history, you're trying to remember a specific reaction you had to a new medication, and you're navigating the natural processing lag that comes with age. Before you can even finish describing your primary concern, the doctor has already steered the conversation toward a diagnosis.
Why does this happen? Follow the money.
In the United States, most clinics operate on a volume-based model. To keep the lights on and satisfy insurance conglomerates, a primary care physician is often pressured to see a new patient every 15 to 20 minutes. Within that tiny window, they have to review your chart, perform an exam, write notes, and send prescriptions. For a senior with multiple health layers, 15 minutes is a mathematical impossibility.
Look at Mildred.
She had the key to her own diagnosis, her diet. But because she was interrupted at the 11-second mark, that information was lost. The doctor saw swollen ankles, thought heart failure, and increased her diuretics. 2 weeks later, Mildred was in the ER with severe dehydration and electrolyte imbalance. The 11-second interruption didn't just save the doctor time, it nearly cost Mildred her life. Physiologically, seniors need that extra time. Your body doesn't give off clean signals like a 20-year-old's does. Fatigue in a senior could be anything from a heart block to a simple B12 deficiency. Narrowing that down requires a conversation, not a monologue. When a doctor rushes you, they aren't just being efficient. They are increasing the statistical probability of a misdiagnosis by 25%. The system treats your time as free, and the doctor's time as expensive. They expect you to wait 45 minutes in the lobby, but they won't give you 45 seconds to explain your symptoms. This is a power imbalance that favors the clinic's bottom line over your biological safety. So, how do you reclaim your 15 minutes? You have to become a time defender.
First, the pre-game list.
Write down your chief complaint in one sentence. I am here because my ankles are swollen and it's making me dizzy. Do not lead with a story, lead with the headline to grab their attention before the 11-second clock runs out. Second, the hand-on-hinge reset. If the doctor stands up to leave and you aren't finished, say, "Doctor, I have not finished sharing the most important symptom.
Please sit back down for one more minute."
It sounds bold, but it breaks their automatic exit reflex. And third, the summary request.
Before they leave, ask, "Can you repeat back to me what you heard today?"
If they can't summarize your concerns, they weren't listening, and you shouldn't accept the treatment plan. You've spent decades contributing to this society and this healthcare system. You are not a slot in a schedule. You are the reason that building exists.
Done. Let an 11-second timer decide your future.
We've reached the top of the mountain, and the air here is cold. We've talked about time, complexity, and dismissive attitudes. But the number one ugly truth, the one they will never ever admit to you in a sterile exam room, is biological valuation. It's the quiet mathematical calculation of how much utility your life has left. In the high-stakes world of emergency rooms and surgical suites, the system isn't just looking at your symptoms. It's looking at your return on investment. Imagine two people walk into an ER with identical chest pain. One is 45, the other is 75. In a perfect world, they get the same urgency, the same tests, the same life-saving technology.
But we don't live in a perfect world.
We live in a world of medical rationing. A groundbreaking study in The Lancet analyzed emergency care and found that patients over 70 with acute chest pain were 22% less likely to be given life-saving interventions like stents compared to younger patients with the exact same symptoms. Why? Because of a hidden bias called quality-adjusted life years, or QALY. The system asks, if we spend $50,000 on this stent, how many productive years are we buying back? If the answer is 40 years, the gates open. If the answer is 10 years, the gates start to swing shut.
Look at Elmer.
He was active, he drove, he volunteered. But the moment he hit that gurney, he ceased to be Elmer the volunteer, and became the 79-year-old syncopal episode. The staff looked at his age and subconsciously dialed back the intensity. They chose comfort care over curative care, without even asking him. 2 weeks later, Elmer suffered a massive stroke from a blocked artery that a simple scan could have caught. The system didn't fail Elmer by accident, it made a value judgment on his life. Physiologically, your age is not a contraindication for success. A stent opens an artery just as well at 80 as it does at 40. Radiation kills cancer cells at 85 just as effectively as it does at 35. The biology of healing doesn't have a cutoff date, but the system's willingness to try does. This is the ultimate ugly truth. The healthcare system has been conditioned to see your death as natural, and therefore less of a tragedy to be prevented. How do you fight a bias that is woven into the very fabric of the hospital? You have to make yourself human again.
First, the active life proof.
When you enter an ER or a new specialist's office, don't just list your pains.
Mention your life.
I live alone, I drive, I garden, and I plan to be at my grandson's graduation in 3 years. You are forcing the doctor to see life years that are worth saving. Second, the why not.
Question.
If a doctor suggests a wait-and-see approach for a serious symptom, ask, if I were 40 years old, would wait and see be the standard of care, or would we be in surgery right now?
Third, the healthcare proxy.
Never go into a major medical situation alone. You need someone there who knows your biological value and isn't afraid to demand the highest level of intervention. You are not a depreciating asset. You are a living, breathing human being whose experience, wisdom, and future are priceless. The system might have an expiration date for you, but you don't have to accept it. You've spent a lifetime standing up for others. Now, it's time to stand up for the most important person in the room, you. These 5 truths are ugly, but knowing them is your greatest power. Share this with one person you love who is over 60. You might just save a life, maybe even your own. I'm Daily Health 365, and this is the truth about your health.